Hi, I'm Dr. Kristen Sato. I'm one of the primary care doctors here at Student Health and one of the providers that performs IUD insertions. So today we're talking a little bit about IUDs or intrauterine devices. They're over 99% effective as a form of birth control, and they're more effective than pills, condoms, withdrawal, any of the other hormonal types of birth control because they work independently of you, meaning that you can't forget to take them or come in and get a shot or anything like that. The three types of IUDs there's two hormonal types, and those are Skyla and Mirena, and then the non-hormonal, which is the Paragard or the copper IUD. Once you talk to your provider, you can decide which IUD is best for you, and meanwhile you probably have some questions or concerns about the IUD. So before you get an IUD, it's really important that for the 2 weeks prior to insertion that you use consistent contraception. This is super, super, super important because we don't want you to be in the process of getting pregnant at the time when we place your IUD, and our pregnancy test only covers from 2 weeks prior and before, and so those 2 weeks are really the important time. If you've had an episode of unprotected intercourse, vaginal intercourse, at the time of the insertion within those 2 weeks, then we will ask you to reschedule, so it's very important that you're honest with us about that. Before you have the IUD inserted, we usually do prescribe a medication called misoprostol, but not every time. So this is a medication that we use to help to soften up your cervix or the bottom part of your uterus. It helps with just the ease of insertion and some of the cramping. This medication is placed vaginally about 8 to 12 hours before your insertion appointment. You don't need to wake up in the middle of the night to place it. You just place it the night before or early the morning of, depending on the time of your appointment. And then it may cause some cramping and spotting, so that's totally normal. And then you just come in for your appointment and most of the pill will have dissolved by that time. There's also a medication called Ativan that we give some people who have bad anxiety, and again, not a medication that we give every single person, but you can talk to your provider about if that's appropriate for you. On the day of your insertion appointment, you should take ibuprofen or Advil, 600 to 800 milligrams, just about an hour before you come in for your procedure. So that will be 3 or 4 of those little brown 200 milligram pills. This will help with the cramping associated with the insertion, and then also afterwards with the cramping. When you show up for your appointment, you will provide us with a urine sample, so make sure that you don't pee right before you come in, and we'll do a pregnancy test at that time. You may choose to bring someone with you if you want to. You don't have to. They can either be in the room with you at the time of insertion, or you can leave them out in the lobby. We do recommend that if you take that Ativan medication that you do bring someone, because we don't want you to get in a bike accident or anything else to happen if you're driving home after the appointment. At the appointment, you will have your vital signs taken once you're in the room, and then be asked to undress from the waist down, so no underwear or pants. You'll sit on the exam table, and we'll have you lay back and put your feet up in the stirrups, and then a pelvic exam will be performed at that time. We'll place the speculum, which is the instrument that we place in the vagina, and open it up to look at the bottom part of your uterus. And then at that time, we usually do an STD test, so for gonorrhea and chlamydia, if you haven't had one of those tests done in the past 6 months, or if you've had a new partner since then. Your provider will also go over a consent form with you and answer any additional questions that you have. If anything comes up before the appointment, you can always send a healthy message with any questions that you may have. During the placement of your IUD, you will have cramping for about 1 to 2 minutes. Typically, this is just like a very bad period cramp, and the worst of the cramping occurs while you're in the exam room during the placement and will get better by the time you leave the exam room. Some women do have cramping for several hours to even days afterwards, but it's not anything that you won't be able to handle, and you can take ibuprofen afterwards as well for that. After the placement, then your provider will teach you how to check your strings, which should be done about once a month. And typically we recommend checking your strings at least one time before you come back in for your string check appointment, which is made about 4 to 6 weeks after the placement. At that appointment, we use a speculum and just look at the strings and make sure everything is going okay and talk to you a little bit more about your IUD. And that appointment is very, very quick, typically only takes about 5 minutes. We recommend not putting anything in the vagina for the first several days after your placement, so about 3 to 5 days depending on your provider. So that means no tampons, no intercourse, no menstrual cups, no douching, nothing in the vagina, because you are at a slightly increased risk of infection during those first few days after the placement of your IUD. Again, you can take ibuprofen if you have any cramping, which is very, very normal, and you will have spotting after the placement. And the spotting can last, depending on which IUD you get, between several days to several months after your placement. Very normal. Again, you can ask your provider if you have any questions about what is normal after your placement. We also recommend that you use a backup form of birth control for the first 7 days after placement. So remember, nothing in the vagina for the first few days, and then if you have intercourse, vaginal intercourse, those next several days, then we do recommend using backup birth control. So that can be completing out your birth control pill packet or using condoms or abstinence. What is normal after your IUD insertion? Cramping is normal, spotting is normal, spotting to bleeding potentially, just depending on where you are in your menstrual cycle. So worrisome things and when you should call the advice nurse would be if your cramping is getting progressively worse instead of better. If your cramping is associated with fevers, that's worrisome that you may have an infection or potentially a perforation, which means that there could be a hole poked in your uterus at the time of the insertion. Or if your bleeding is prolonged and is more than just spotting for several weeks, if you're actually bleeding and using tampons or pads for weeks to months afterwards, would be a reason to call the advice nurse.